Welcome and thank you for joining us for the presenter series. And we're moving straight ahead with a couple of wonderful guests tonight, Roy Hunter and Bruce Eimer. Although I see Bruce and his smiling self, I believe Roy had some issues with taking his wife for some surgery, I think, today. He will join us hopefully before too long. I believe Michael actually was in charge of introducing Roy. And would you like to do that first, or you want me to introduce Bruce while we have him, and we can then do a little introduction to Roy when he shows up?
Yeah, that's a good idea.
Okay, well, let me talk about Bruce a little bit. Bruce Eimer and Roy Hunter have been working together for a while, putting things together for pain management, and they work really well together. Bruce is a licensed psychologist. He's treated thousands of clients with anxiety and mood disorders and chronic pain. He was the director of pain. I'm sorry, I lost my place. He was the director of pain psychology at the hospital pain clinic. That's really impressive. I want to ask you about that, Bruce. And served on staff of multiple hospitals. He's given hundreds of talks and workshops and has authored 9 books. Bruce is a licensed psychologist in Florida and holds licenses to practice in Pennsylvania and New Jersey. He's a diplomat of the American Board of Professional Psychology. And so you came through this from a psychology background, right, Bruce? You came to hypnosis that way?
The answer is yes and no. I was always searching for the therapeutic approach that I could call my home. And when I discovered hypnosis, I knew that I had something that was very valuable. And even though I continued my search by exploring various therapeutic approaches, I stayed with hypnosis since introduced to it back in 1987 or thereabouts.
So Bruce, I really know you in the category of a pain guy. Not a guy with pain or a guy who brings me pain, but a guy who relieves pain. How does regression roll into that? And Roy, I know is the pain man, is the parts guy and the regression guy. How did you two mesh?
Well, those are 2 separate questions.
Okay, well, answer them separately.
I'll address them separately. Regression is like the sine qua non, if you will, one of the essential ingredients that are unavoidable, and to use another $1 million word, ubiquitous in therapy. In fact, it's ubiquitous and ever present in life in terms of what we go through every day, just like we go in and out of hypnotic-like states. We regress all the time. In fact, going way back to the Neo-Freudians, they used to talk about adaptive regression and the service of the ego, which of course was the basis for many of the psychoanalytic approaches. How does regression relate to pain? Well, people that have chronic pain are constantly regressing all the time, both in terms of their functioning and in terms of wishing for a time before they were in pain. So that is a lead-in to helping them to get pain relief and learn how to cope better with their ever-present current pain problem. How Roy and I got together was I wrote a book with a pioneer in the field of hypnoanalysis and medical hypnoanalysis that was published in 2006. It was on regression therapy, but it was termed, because another term for regression therapy, probably a broader term in some respects, is hypnoanalysis. I was always interested in hypnoanalysis because I was, number one, trained in a psychoanalytically oriented clinical psychology program. And number two, it always seemed to, psychoanalytic approaches always seemed to bring out the truth of human beings' psyches. It just made a lot of sense to me and resonated. So when I took a course in idiomotor finger signaling and hypnoanalysis back in the early 90s with a fellow who was a medical doctor. He was a surgeon and an emergency room physician His name was Dabney Ewan from Tulane Medical School in New Orleans. I was hooked, and he and I became friends, and we eventually co-authored a book together that came out in 2006. And the book is called Idiomotor Signals for Rapid Hypnoanalysis. I didn't think the book was complete. We published it, we got it done, and I wanted to do a second edition, but Dabney wasn't really into doing that. And then a friend of both Roy and myself, who is the lead guy, the lead publisher for Crown House Publishing in the United States, Mark Tracton, had approached me because he had published another book of mine on pain, republished it. And he asked me if he said that he thought that perhaps I ought to meet Roy, because Roy was doing regression work, and I was talking to Mark Tracton about publishing this second edition of, or volume 2, if you will, of the book on hypnoanalysis that I wrote. Anyway, to make a long story short, Roy and I met somewhere around 2010 at a National Guild conference up in Massachusetts. And we hit it off, and we became buddies. And I don't know, that's kind of how things got started. And we decided to write this book, which was published in 2012, and it's called The Art of Hypnotic Regression Therapy. And that's what our workshop that we're teaching in May at our IMDHA conference is all about. The Art of Hypnotic Regression Therapy. So I hope that answers your question.
It does.
By the way, regression therapy is, I heard you say, is yes, Bruce, the sine qua non.
Yeah.
And it's kind of curious because one of the things that I have noticed in the world is people tend to really have strong opinions about regression therapy. Some people think you should never do it. Some people think it's the only thing to do. So, there's just a lot of strong opinions about it. Why is it that some hypnotists are skeptical? There's a new word. Are skeptical of regression therapy?
Well, because what happened was the idea of regressing clients to their childhood to find out if in fact they had been abused became all the rage among many therapists in the 90s. And as a result of the over enthusiasm of many therapists, they did a lot of leading and suggestion with clients, which led them to create false memories. That created a big problem politically and legally and sociologically and everything else. And essentially, there was a backlash in the after Y2K about doing regression, because there were so many poorly trained or not trained hypnotists and therapists that were doing wild regression therapy. And they were regressing people, and they were essentially leading them to and suggesting that things happen that didn't happen.
I know Roy's not here, but I'm going to speak for him for a moment because I've been a big fan of Roy's for a long time. I've known him for years, and I've heard him tell this story a couple of times. One of the reasons Roy is such a stickler on being careful with your wording, with not leading clients, etc., is because he experienced it once, right, Bruce?
Yes.
He had a student actually who said, "Oh, can I hypnotize you?" And he told the student, "Yeah, sure, go ahead." And they did a regression, and he went back to when he was young and in his house, and there was some light outside his bedroom window, and he was awakened in the middle of the night. And the student regressing him said, she didn't say, "Oh, what is that light?" which might be the right way to do it. She said, "Is it a UFO?" And it could have been a street light. It could have been anything. But now Roy says to this day, he doesn't know, because it certainly became a UFO as soon as the message was mentioned, right? And so, Bruce, I take it that you guys spend quite a bit of time in regression therapy training, actually training people how not to implant false memories, how to do it the right way, because you can certainly regress somebody without leading them down a path to UFOs.
You know what? We try to teach. The thing about this training, the hypnotic regression therapy training, which Roy and I are giving the 2-day workshop on this May, is that it's evolving and it's getting more and more precise. And what we're trying to do is we're teaching people how to utilize hypnotic techniques in the service of helping them to find answers about the causes of their problems and symptoms within their own inner mind, feeling mind, subconscious mind. And inevitably that links back to their memories of their past experiences. And we teach people in this workshop how to do it in a competent manner, in a clean manner, utilizing clean language and verifiable or evidence-based concepts. So we don't spend a lot of time telling people what not to do, but rather teaching people what to do and modeling it and doing demonstrations and doing practica, you know, where people actually go into breakout rooms now that we're doing the online stuff and practice specific skills, which once they develop this skill set, they can put together and utilize to actually conduct hypnotic regression therapy. We have a very detailed manual that we give out. And of course, there are some videos to watch. And of course, we strongly suggest the suggested reading for the course is the book that Roy and I co-authored called The Art of Hypnotic Regression Therapy, which is published by Crown House Publishing. It's Hunter and Eimer. And the book that I co-authored on idiomotor signaling techniques in hypnoanalysis, which is Ewan, E-W-I-N, and Eimer, published by Charles Thomas back in, I think, 2006. And between taking the course and reading those two books and practice, people will develop a skill set, practice a skill set, hone their skills in using the skill set in being able to use this very powerful technique of hypnotic regression therapy. So, you know, hypnotic regression therapy has been one of the best kept secrets in hypnosis. It's what Cal Banyan, a noted trainer, talks about as the hypnosis for the 1% of hypnotherapists that, you know, want to really utilize hypnosis deeply and help people to go beyond simply symptom relief, which most of the time leads to symptom substitution and is temporary at best. So it goes way beyond direct suggestion and hypnosis.
But I just have to ask, Bruce, are there times when regression therapy is appropriate and times when it is not?
Well, there are definitely times when regression therapy is not appropriate. Regression therapy is very useful in helping people to get well when they have any type of anxiety disorder, phobias, panic disorder, and also any kind of post-traumatic stress disorder. It's very useful for that. It's not so useful. I wouldn't, you know, launch into that if somebody comes in and they want to stop smoking. You know, I use direct suggestion and hypnosis and reframing, waking state reframing. But if the approach that I use, which is a direct suggestive approach to help people stop smoking, doesn't work and they have to come back, then we have to identify what the blocks are. And very often we have to do regression then. I don't use regression. I never say never, but I typically don't use regression when I'm treating depression. You know, I've taught a course last year, a 2-day workshop at our first annual virtual conference for IMDHA on hypnosis for depression. And I didn't do very much in talking about regression because when somebody's depressed, it just doesn't work very well. I mean, once you've enlisted them as a collaborator and you've moved beyond their depressed state and you're helping them to work through issues, regression therapy can be very helpful. But, you know, regression therapy, whenever you remember something to one degree or another, you regress. What does regression mean? It means going back. going back to another time, going back to another time when you behaved differently, when you felt differently. And the way that human memory works is through association. So that we're regressing, as I said earlier at the beginning of our conversation, we're regressing every day spontaneously when we hear a piece of music that brings us back to a time when we were younger, when we were with somebody that we're maybe no longer with. You know, you can't avoid it. And when we do therapy, and we do good therapy, we want to help a client who is stuck understand why they're stuck. We want to help somebody that reacts in an irrational or self-defeating or dysfunctional way in certain situations or in many situations. We want to help that person understand, where it came from. And it's not about just focusing on the past. It's about learning from the past. Because if you don't learn from the past, how do you move forward in a better way? So regression therapy is about utilizing in the service of therapy in a formal way or an informal conversational way, what we do all the time. I'd like to share a little experience that I had yesterday. Yesterday, I read something on Facebook that got me depressed. I read somebody's post that they had to put their dog down. And, they said their dog had suddenly got sick, and the dog got very sick, and the dog, could not really live anymore that way. And they had to put their wonderful 7-year-old Rottweiler down. And I immediately felt like, I'm talking depressed. I felt really sad. I regressed. And I regressed to a time, spontaneously, unintentionally, 2 years ago, when I had to take my wonderful, beloved German Shepherd, who was only 5.5 years old and who had lymphoma. She had lost like 25 pounds. She couldn't move. She lost all strength in her legs, and she lost control of her bowels and bladder. And I had to take her to the emergency center to see if there was anything else that they could do for her, and they couldn't. And they advised me to put her out of her suffering. And they brought me into a room that was their euthanasia room, where they said, we're going to hook the IV up, but you can spend as much time with her as you wish, and you indicate when you're ready. And I spent 3 hours with my dog. Her name was Heidi, wonderful dog. 3 hours until I gave them the indication that I was ready. And I watched her leave this planet and, go up to cross over the Rainbow Bridge. And, she died well. She was with me all the time, and I was right there with her, but I was so sad. And, to this day, I love that dog and I miss that dog. And when I read that post on Facebook last night, it brought me back to being in that euthanasia room with my dog Heidi. And I traveled back on a bridge, an affect bridge. The affect bridge was that feeling of sadness, of profound grief and sadness that I felt for that person who had to put his dog down yesterday or the day before. And in this course, we teach the very, very powerful technique of the affect bridge to help people to regress in a safe way back to the formative experiences that led to their current problem, symptom, current mood state that is problematic, whether it's anxiety or sadness or anger or shame or what have you. And we teach variations, very precise variations of the affect bridge. We teach the somatic bridge, which is going back on a bodily sensation. We teach the cognitive bridge, which is going back on a thought. And clearly, when I read this post yesterday in Facebook, I had a thought about how bad it is to have to do that, to have to put your dog down, your buddy, this person, dog person. I treat my dog as a person. I have a German Shepherd now, of course. Take this person out of your life. So that was like a cognitive bridge. But we teach the idea that, you have to be able to work with at the same time cognitions, affect, and sensations. You have to be able to work with imagery, which is a form of cognition. And so when you work with imagery, cognition, affect, and somatic sensations, okay, you're combining all of these powerful modalities to help somebody to go back and find the initial and subsequent sensitizing events that led up to their current problems.
Okay.
But it's not easy.
Sure.
And it's not simple. It's really complicated stuff because, as you all know who have trained in NLP, people have different lead or preferred representational modalities. So if you try to do an affect bridge with somebody who doesn't really have much in the way of feeling, and they're more cognitively oriented, more auditorily oriented, then you're probably not going to regress them very well. So we teach in this course how to assess what form of regression is going to be most effective, to test it, to do convincers, to help somebody to really experience what they're experiencing as real, even though they know that they're sitting in the office or sitting in their home when they're doing virtual therapy with you, and then help them at that point to explore what the territory is, and then reframe the ideas that underlie their problem, and then release their emotional attachment to those ideas, and then come back to the present and to seal the deal, so to speak, with suggestion and imagery and future pacing, mental rehearsal. So, we incorporate techniques that are appropriate in a kind of a multimodal paradigm. It's not like we're just doing one specific thing. Hypnotic regression therapy incorporates a lot of good stuff.
Yeah.
And
Bruce,
that's what we teach in this course.
let me jump in for a minute. I just want to check with you about this because, I don't mean this sarcastically, so please understand. I saw the Three Faces of Eve. Do you remember that movie?
Yes, I do.
So now, and it's so old that it was black and white, by the way. We started out today with a list of old things, by the way. So yeah, but I remember in that movie, so Eve found out what the cause of her problems was, or she found a particular memory. And the story doesn't go very far to say much more about it, but I think that it was that story and some stories like it that created the idea in people that if you can find the cause, as soon as you found the cause, that the problem will just clear up all by itself. Is that true, or do you have to do something more?
It's not true invariably.
And again,
sometimes.
sorry for interrupting, but the reason I'm asking is I know some people that have problems that that just started yesterday. Right? So the idea of and I also know some people who will tell you, I've got this problem and here's where it came from. This happened to me when I was a child. And this is the result of that. But knowing that source doesn't seem in and of itself to be enough to make a difference.
Well, let me tell you something. That's where parts therapy comes into play.
Okay.
What happens in life, in the course of our lives is that in our early lives as children, we encounter different experiences which lead us to create a number of different aspects of ourselves to cope.
Mm-hmm.
When we experience trauma, there are parts of ourselves that become burdened with the trauma and hold that trauma and become exiled from the core self and from the subselves or the parts of us that actually manifest in today. So there are these exiled parts of ourselves that live in our unconscious mind that hold these burdens and create lots of persistent problems for people until those parts are uncovered and helped to unburden themselves. So you've heard the term many times, the importance of witnessing the pain. Those exiled parts of ourselves, they need to be accepted into the internal family, and they need to be helped to release their pain. And first, the rest of the person, the different parts, as well as the core self of the person, has to be helped, has to be guided to witness the pain that those exiles are holding inside for the good of the whole, for the good of the person. And so your question, what was your question again? I'm sorry, I got a little bit.
Well, you're starting to answer it because it occurs to me that when you found the source, maybe there's a particular event, something happened when they were a child, and you do the regression work, and it takes them to that that thing that might very well be called the initial sensitizing event. But knowing it isn't, it doesn't seem to me that knowing it is enough.
No.
So I know once you get there, you interact with that memory in some particular way. Isn't that right?
Right. Yeah, that's what I was getting at, and I'm glad you asked that question. So this is where the complexity and the trickiness of doing effective hypnotic regression therapy comes in, because it's not enough just simply to find a causal event.
Right. Good.
And then once you find a causal event, and the client is helped to relive it, to review it, and if revivified, relive it. It's what you then do with it naturally, and the person themselves needs to be helped to, the client needs to be helped to unburden him or herself of all of the stuff that's stuck in there, that's frozen in time. And in order to do that, you need to often interact with different parts of the client, invite different parts to come forward and to converse with one another and talk about it. But you also need to do a lot of smart cognitive reframing to help the client to change his or her view of the self. The core self has not a very good view of his or herself as a result of those experiences, which are frozen in time. So it becomes a challenge. And in this course, we teach different techniques for helping somebody go back and change, work with and change the stuff that's stuck and unfreeze it, you see. Informed trial technique, forgiveness work, that's all included, and that's all part of it.
Sure.
Parts work, of course, is a separate course in parts therapy that Roy teaches, as well as certification for parts therapy trainers. But we do teach a little bit of it in the hypnotic regression course. And I might add that if a therapist, a hypnotherapist, wants to learn how to do competent parts therapy, they need to learn how to do hypnotic regression therapy first, because they're going to really get stuck.
Even though you're talking, Bruce, about it's great for pain and it's great for finding those initial sensitizing events and getting back to the core of the issue, regression therapy, once you're good at it, can be used for really positive things too. I know we've been talking about a lot of negatives and dogs dying and things, but you can certainly use regression therapy for positive things, like regressing back to a resource. Right? If someone is they come to you looking for confidence, you can also regress them right back to a time in their life when they had confidence, maybe not in speaking in front of people, but certainly in doing something else, and have them relive that and bring in those feelings and what they did to create that confidence, and use the regression work for positive outcomes just as much as you can use regression work for negative or to clear up stuck outcomes.
Absolutely. I'm really glad that you mentioned that, because that is absolutely true. Absolutely is a way of going back and accessing positive resources based upon positive experiences and successes in the past. Absolutely.
I just wanted to point out, it doesn't all have to be bad and horrible stuff. You can use this once you know these techniques, once you've read the book. And I don't know that I mentioned it, Bruce, and this would be my fault, but Bruce Eimer and Roy Hunter will be doing hypnotic regression therapy on Wednesday and Thursday before the conference. And then on Monday and Tuesday after the conference, they're doing Train the Hypnotic Regression Therapist. So I've got a question about that one too, Bruce, and that is where you're training people to train people to do regression work?
Yeah, this is a new course that we've just launched. And basically what we're doing is we're teaching hypnotherapists who have taken the training in how to do hypnotic regression therapy, how to teach other therapists how to do hypnotic regression therapy. So it's basically a course in learning how to teach it. Okay.
Mhm.
And please make no mistake about it. You know, to get good at anything, you know, you have to take training, you have to read, and then you have to do. You have to do. So, you know, you take this course on how to do hypnotic regression therapy, which I hope all of you here that haven't already taken it will take it with us. And you learn how to do it, and then you got to go and do it. Now, if you choose to take our hypnotic regression therapy how-to course, it's a how-to course, and you know you really want to learn how to teach it to others, then you take our post-conference course on Monday and Tuesday on becoming a certified regression therapy trainer. But guess what? It's not about getting a certificate that says you're a certified HRT trainer. The best way to learn how to do something is to teach it. So one of the light bulbs that both Roy and I had pretty simultaneously that led us to develop that course, which is going to be on Monday and Tuesday post-conference this year, is that people take the course on how to do it. They want to learn to do it competently, so they're going to have to practice it. But the best way to get on the path to doing it as competently as you can possibly do it at an initial stage when you've just learned it is to learn how to teach it and to understand the conceptual basis for doing it, which is what you have to understand in order to teach it. So by learning how to teach it, you may not, you know, you're not going to become a competent instructor of hypnotic regression therapy right away. Most people won't. But it'll accelerate your ability to start using it in your practice. And when you start using it in your practice, you're going to have all the materials that we give you to teach it eventually, you know, when it's appropriate for you to do that.
And when you start practicing and using it, Bruce, you're going to run across clients who cry. They're going to get regressed back to something. Talk to us about how, and don't be afraid of clients who cry, but talk to us about that.
Okay. Glad you asked. We're talking about abreaction. Yes, abreaction. Listen, I got to tell you something. If you cut people off when they start to get immersed in a mood state of either sadness or grief, anger, whatever it is, you know, shame, if you cut them off, you miss a golden opportunity to help them to move beyond. You have to feel in order to heal. You have to communicate to clients at the outset. We teach this also in this course. You have to teach them why they have to feel in order to heal, that they have to stop trying to suppress and bury their feelings. You know, the idea here is that therapy is both cognitive and experiential. So when somebody has an abreaction, let's say they start to cry, what you're doing is, and this is what we teach, the techniques are to help them to utilize that experience right there in the session to access old feelings that were buried, that are are causing to a large degree their current symptoms, the symptoms being an unconscious solution to the problem. The problem was they had this horrible feeling which they couldn't handle, so they encapsulated it, they buried it, it got frozen in time, and they come up with, when enough series of sensitizing events occur which make the pot to run over already, then one activating event leads to the emergence of the symptom. So you want to get to the original initial sensitizing event and the subsequent sensitizing events, which kind of fall like dominoes once you hit the initial one and several subsequent ones that are core. And you want to utilize that gold of therapy, which is the abreaction, to help somebody regress back in a controlled way to those initial and subsequent sensitizing events. So you should never, unless you're dealing with somebody that's very unstable, and this is part of the assessment process, is it safe to let somebody emote in therapy with you? This is part of the assessment process, and we go over a checklist to determine if it is, or if not, use direct suggestion and hypnosis, and don't use regression therapy. Even though the person may be regressing like crazy, you may not be able to handle it. Again, there's some, cognitive thinking that goes into that as well, because, if I don't want to go on and on a soapbox, but I do want to tell you this, that you asked earlier, I forget if it was you, Karen, or it was you, Michael, when is hypnotic, I think it was you, Michael, when is hypnotic regression not indicated? This gives me an opportunity to make a very strong point. It's not indicated when you don't have any competence or experience to work with a particular kind of problem. If you don't know anything about dissociative disorders, don't use hypnotic regression therapy or hypnoanalysis to help somebody with it. If you don't know anything about chronic pain, get training in treating chronic pain before you use techniques to help people with chronic pain. So when you get somebody abreacting, if you're comfortable with the particular type of problem that person has, then you could use that abreaction in an adaptive, constructive way to help them, to regress them to the sensitizing events, the activating event, or the symptom producing event, which may have happened yesterday, Michael, or may have happened 20 years ago. Usually sensitizing events happen, long time ago, but precipitating events could be yesterday.
Bruce, the reason that I asked that question that way is that I actually am aware of a particular hypnotist who thinks that regression therapy is the only thing that there is, and you use it for everything. And he had a client that came in to deal with some pain because he had been in a car accident, and so he's got pain in his neck and stuff from this car accident. He goes to the hypnotist, and the hypnotist wants to find the cause of this in childhood when when we know that it just happened like a couple of days ago in a car accident. So those are the things, and I appreciate your response to that, because that's what I'm concerned about, and that doesn't seem to be what you guys do. You've got good stuff, and I know that you got good stuff. We didn't get to introduce Roy, by the way, and I've got to tell you, I have known Roy for, probably 30 years now. He's the first hypnotist that I ever actually really knew and got engaged with, because there was a period of time when we were all communicating on the internet in these Usenet news groups, way back before AOL, before everything else. It was like computing at the DOS prompt, and Roy Hunter was a part of that conversation. So anybody who takes this course gets, you've been listening to Bruce now, and you hear that he has a deep understanding of the subject, but also gets this experience of being with Roy Hunter. Can you tell us, Bruce, if just so that people can get the idea in their mind, if they're thinking about taking your course, if I walked into your classroom in the middle of the first day, what would be going on? What's it like in there? Is it more lecture-y, or is it a lot of exercises, or how do you do that?
Well, if you walk into our classroom in the middle of the first day or the middle of the second day, you might be listening to a lecture by either Roy or I, or an interactive conversation, between Roy and I, or you might, be witnessing several breakout rooms where people are practicing a skill. You might be watching a video of Roy or I working with a client, or
Forgive me for interrupting, but you're cracking me up, because I realized when I asked that question, I don't know how it is that my brain works, but every time I think about these programs, and I do so many programs online, and every time I think about doing them and I'm getting it organized and putting it together in my mind, I'm seeing it in a live environment in a classroom. So I said, if I were to walk into your room, obviously I would just pop up in a box on the corner of a screen somewhere in this particular.
Crazy, right?
So, well, it is crazy. It's a very different thing, and so I wonder. But they're going to be in breakout rooms and stuff, so they're going to do regression work with one another as well. Is that right?
Yes,
yeah,
absolutely. And you're going to learn, if you take our course, you're going to learn how to use ideomotor signaling in a I would say a very confident manner. You're going to take this course, you're going to understand how to use ideomotor signals as a tool in doing hypnotherapy with people. You're gonna learn how to do it. I hesitate to say in the right way, but you'll learn how to do it in the right way. I mean, you're really going to see that it's a direct connection with the unconscious or the feeling mind, and you'll find that you'll be able to use not only ideomotor signaling to empower your own hypnosis work, which is very, very, very powerful. But you're also going to learn about how to use certain concepts to assess your clients, such as the 7 psychodynamic keys to emotional problems, which were developed by David Cheek, MD, and Leslie Leckrone, his collaborator, back in the 60s.
Yeah.
And I trained with David Cheek in the 90s, only for a few years because unfortunately he passed away in 1996. But I was a big fan of his, and he was a very kind mentor, and I learned a lot from him. And so I teach that with great love for this man. And you'll learn how to do that. You'll learn how to use the 7 psychosomatic keys, or psychodynamic keys, I'm sorry, to assess the likely type of cause, the category of causality of symptoms. And then, it'll inform you, will teach you how to use that assessment to determine whether or not regression is indicated, or some other type of technique, such as parts therapy or direct suggestion. Very often, depending on the cause, again, getting back to your initial question, Michael, about when regression therapy is indicated and when it isn't, with the psychodynamic keys, sometimes we find that the cause of a problem is some suggestion that somebody got that was negative suggestion, or an irresponsible suggestion that somebody gave, or a negative idea that somebody's holding in their mind, and we can just use direct suggestion to remove that suggestion. Right. We don't have to do regression. But you want to understand how to work with the person, when they do regress and they react. And that can happen. And that happens so often in therapy. Therapists are very often afraid of it and cut it off, especially the cognitive therapists, And I was trained in how to do cognitive therapy. And, I left that fold a long time ago because I recognized how limited it really is.
Yeah.
So you'll learn all that and more by taking the course with Hunter and myself.
It sounds wonderful. It's like an exciting adventure for the hypnotist. I wonder, just to make sure, this is just, we're running out of time is the issue, so I'm rushing here with this. I just want to know if I have, maybe I don't want to do all 4 of these days. I mean, so you've got the hypnosis regression therapy the 2 days before the weekend of the conference. You've got the train the hypnosis regression therapist the 2 days after the conference. If I have taken the first class, the first weekend class, somewhere in the past, then I'm assuming that that means I could take the trainer class this time around. Is that right?
Yes, if you've taken the hypnotic regression therapy course before, you can take the I mean, you can do whatever you want, really. I mean, we're not saying you can't, but you would be best off taking all 4 days. And I know we offer some kind of discount, some big discount on taking the first 2 days to people who have already taken it. So you could take it as a review at a greatly reduced rate, and then take the certified hypnotic regression therapy trainer course
Yeah.
post conference on Monday and Tuesday.
But I can't do everything that I want to do because I mean I can't take the trainer course if I haven't already done the other course. Is that correct?
Right. I probably misspoke. No, you can't take the trainer course unless you've taken the HRT hypnotic regression therapy course at some time in the past. Yeah, I'm sorry, I misspoke.
Oh, yeah.
Erase that. You can do whatever you want, but you can't take the hypnotic regression therapy course unless you've taken. I mean, you can't take the trainer course unless you've taken
the original course. Yeah. Okay. So great. I'm really sorry that we're at the end of our time, but and especially that we didn't get a chance to see and talk with Roy tonight as well. So I'm hoping that he's going to see this video, and we'll send him our love. I know he had some things going on that kept him away from us, and it was rather important for him to.
Yeah, Roy was really, regretted that he couldn't, be here now, but, he did have to take his wife for a medical procedure, and, the timing of it, that obviously comes first, and
Yeah.
that timing is.
Well, and aren't we lucky, on the other hand, that Roy wasn't hoofing it solo, and we got Bruce Eimer to talk with for 45 minutes here this evening. So thanks so much, Bruce.
You're welcome. It's always a pleasure.
Here's the course: 2 days before and 2 days after the program, hypnotic regression therapy, and train the hypnotic regression trainer for the 2 days afterwards. Sign up. It's going to be an exciting adventure. And with that, we do have to say goodbye. So, Karen, I'm going to say goodbye to you first.
Goodbye to you, Michael. Thank you, Bruce, very much. And thank all of you for joining us tonight.
It's been a pleasure. Thank you for having me. It's always a pleasure doing this with you, Karen, and with you, Michael, and seeing you guys at the conferences. So you guys are doing great
person
stuff.
soon, next year in person.
Oh, I hope so. I hope so.
A week from tonight, everybody come back. We're going to have Sheila Granger here talking about her course on create a booming hypnosis business in 2021 and beyond. She's got some great business models. I've been in a couple of seminars that she's did about that topic. And Ajamu Ayinda is going to be teaching MENTAL games, mental games, but it's an acronym. So MENTAL games, a new system for sports enhancement. I don't know what exactly he's going to teach. I'm interested in finding out. But I know this fella. He's been in a couple classes that I've done, and he's absolutely fantastic. So a week from tonight, you will get those two, and we hope you'll come back and join us.
See you then.
See you then, everybody.
Okay. Good night, everybody. Bye.
Good night.
Thank you so much. Goodbye, y'all.
Bye.